Hi guys, it's Carissa. It is 4 a.m. and I can't sleep. And I've been up for a while. If you can't tell, I did my hair and makeup mainly because I have to do a lot of things today and I have a feeling I'm going to run out of steam pretty early. So I figure just get ready so you can go and do things as early as it's appropriate to. And come home and rest. This is the first time I've worn makeup in like 3 weeks, and it's obviously the first time I've made a video in a really long time. If you follow my Instagram, you already know the gist of what's been happening, but I figured I'd just share the rest of the story for anyone who feels invested in our long history and would like to know, because I'll be honest, and I'm going to talk about this a little bit more on my other channel, but I've been also kind of at a strange crossroads with YouTube where I don't really know what my future is going to be with it. I don't really intend to stop, and I don't really want to stop, but I don't really know where I'm going with it. And sometimes it's frustrating because I feel like these matters at this point should just be personal and kept in my own four walls, and that I shouldn't feel like that maybe I shouldn't find comfort in sharing it, because there are some things that you should just keep to yourself, and you need to learn how to find your own comfort and find your own way, I guess. But I've been so open and honest with everyone up until this point that I just feel like it's silly to pretend that things aren't happening, at least when I haven't made a definitive decision to stop sharing these things. Because sometimes I feel like, how many more years can I share this for, with no happy ending, with no, I guess, light at the end of the tunnel. And, you know, does that really give anyone else any hope? Does that really make anybody else feel any better? Because to me, all it does is advertise the fact that there are some people who just never get to that point. And, you know, some days I feel like I should really be realistic and think to myself, you know, that's probably where things are headed, so when are you going to be done? Of course, that's some of the negativity that I've just been feeling over the course of the last few weeks. And I think that now is probably a really good time of day to share this with you, because I feel like I'm less likely to be really emotional about it. But I haven't been very emotional about this all along, because I just feel like, you just feel like it's just too good to be true after a while. So, but there is actually a really good reason why I never really thought this was worth being excited about, and that's part of what happened, so I'll tell you more about that. But basically what I'm saying is, I think I decided the reason why I'm going to share this with you guys and kind of slowly figure out where I'm headed in the future is that some of what happened to us in this was a lot less devastating and a lot more, it felt a lot more commonplace from having heard of other women who've experienced some of this. So, you know, just some of the scenarios that we found ourselves in were a lot less scary. I mean, they were still really scary and still really are, to be honest, but it was a lot less of an impact to hear it, because I know some of you have been through it. If you fast forward to early August, I think it was, late July, early August, all the way back, Mike and I had an appointment with a new fertility specialist that was about an hour and a half away from us, which is a little far to travel, but he was recommended through our new gynecologist's office, and I thought, well, let's go, because I was given the impression that he was a little more progressive and would do things like natural killer cell testing and things like that. I wasn't promised any of that, but I was kind of given the impression that he would help us with, maybe some of the unknowns that we've been dealing with. When I called to make the appointment, the woman on the phone was kind of rude, and she said, well, he's having a really bad month, so he can't see you till September. And it was weird because it was like, what does that even mean? So I think our appointment was on September 8th or 9th. I think it was the 9th. And we waited all that time to see him. We put all our eggs in that basket, and we just thought, this is it. We're going to see somebody new slate, new start. And we drove all the way out there, and Mike had to take time off of work for it. We really dedicated ourselves to this. We were going to be open-minded. And, I know that in a lot of circumstances people would say that we overreacted, but we just went with our gut. We never saw that doctor that day because the office was so terrible. It was dirty. Everybody was really rude. The staff kept acting like they couldn't believe we were there. And the woman at the desk even shouted in front of the rest of the waiting room, why are you here? Because you can't pay for this? And I was like, I don't understand what you're saying. I'm here for consultation. She's trying to get me to sign some form saying I couldn't pay for it. And I was like, no, I don't have insurance, but I'm going to pay for it, obviously. I don't even know what she was trying to get me to sign. And she's like, well, then why are you here? And basically everyone was like, why would you travel all this way to come to this office? And the nurse who took my vitals did that too. And then she was like, well, he's running late, so you guys want to go to lunch or something and come back? And it was 10:30 in the morning. So we were like, go to lunch? How long is he going to be? We drove all the way out here for this. And everybody's acting like we shouldn't have come. So we went out to the car to discuss it and to really kind of, I said, and it was cycle day 1 for me that day. So I said, am I just being sensitive? And Mike was like, not at all. I got a really bad vibe, and I'm kind of glad you feel the same way. Let's not go back in there. Let's just go back to our old place. I'm not going to have you drive all the way out here for, very expensive procedures that aren't covered to be treated like that. We even called the office to just be polite and say, we've decided we're not going to follow through the appointment. And they didn't even know who we were. And we had just been in the office a minute ago. So that was unpleasant. So maybe it was a little hasty, but I decided, nope, I thought I was going to be starting a cycle now. I'm going to start a cycle now. So I called our old facility and I said I wanted to do a baseline appointment. So I went in there on the 11th of September, and that was cycle day 3. So 9, 10, 11, yeah. So it was the 9th to the 11th. They had me come in, and they did my baseline ultrasound, took my blood work, gave me all of my instruction for my medications, and sent me on my way. And around 5 o'clock that day, I took all of my medications because I thought, well, I might as well just do them now instead of waiting till nighttime. I don't know why I didn't wait longer. I think normally I would do it around 8 o'clock, but I thought I'll just do it this time of day because it'll be more consistent, I guess. Well, the office normally would call you if something was different, and they called me at 5:20 after I had already taken my injection of Cornual F, and I think I had taken an antibiotic or something. So it was only a couple of things, but that one injection of Cornual F is like $320. So that was frustrating. But I wasn't around for the call, so I received a voicemail saying, hey, all your blood work looked great except for your HCG. It was 11. So because that wasn't negative, we have to follow that up. Don't take any of your medications. Come back in for another draw, and we'll make sure we follow it down to 0, and then you can start. So I had a period. I was experiencing one then, so there was, at no point did I think that I was pregnant. We hadn't tried whatsoever. I mean, I knew cycle day 1 from the previous month for my appointment, and that's it. I didn't do anything to try and attempt to get pregnant that month. So I was a little shocked, but I just thought, all right, well, it's a bump in the road. I wasted medication. It sucks, but let's keep moving. And then I think my next beta was 64 or something like that. Maybe it was a slower rise than that. I don't remember. But then like the third one was 200, and it kept going up at a very even increment. The numbers were low, but they were still really steady. And once it hit 200, they said, well, let's start supplementing this, start taking progesterone. At one point, once I got to a certain level, they said, start taking estrogen now. And because it was so early and they didn't really have any dating to go by, I had no idea how far along they thought I was. But I now know that I don't know. It's really hard to say, but I feel like it shouldn't be such a mystery whether or not you have a viable pregnancy. The last one I had in like February, March, took weeks and weeks for them to say, there's nothing in there, we can't see anything. They kept looking. If this is viable, I expect to see it right away from now on. I'm not going to hold on to hope. And I know that sounds so negative, but after what we've been through and what our future is going to look like with this, it's so silly to, I'll take the medications, I'll do everything I need to do, but I'm not going to be foolish and believe that there's still hope when there really isn't. So I had one ultrasound. They didn't really see anything. My lining looked thick. She said, there's a little bright spot in the middle of your lining. That's what we're going to watch. I had to wait a whole another week later. That they only do them every week. And my blood work kept going up. And the nurse said, I don't see anything. But there was a black blob next to my uterus in the ultrasound, and she said that might be a polyp, which we can take out later on, and that's not an issue. So that was upsetting, but that was the news, and I had kind of come to expect it. And I had really all along kind of felt like, don't get attached to this pregnancy, because they, since the first day, expected that it was just a miscarriage. And they had told me a few times, don't expect to see this progress. And a few times I had thought that I was actually starting the miscarriage. I would pass some heavy tissue, but not a lot. It was just enough to have me feel a little crampy and start bleeding, and I thought, this is it. And I had all of these obligations that I canceled, and I, with certain people, I felt comfortable, or I felt obligated to tell them because of what I had promised to do. Like, look, I'm unfortunately experiencing a miscarriage, and I'm just not in the spirits to be there. And I didn't like having to share that, but I just wanted to be honest, and I didn't want to seem like a flake. And so I had told several people over the stretch of a couple of weeks, I'm experiencing a miscarriage. But it never really came through. The bleeding would always stop and everything would be fine. And I felt really stupid because one night I was at my sister's house and my dad and my brother were there, and they wanted to order dinner, and they were having everybody kind of pick out what they wanted to eat. They were getting ready to call and order. And I felt this kind of telltale movement, and I thought, here it comes, this is it. I went upstairs in my sister's bathroom, and I passed the largest clot of the ones that I'd passed. But at that point, my spotting was all very, very red, even though it was really clear and very minimal, and I think most of that was from the progesterone supplements. So that hadn't changed. That was consistent. Every time I went to the bathroom, I had really, really bright pink or red spotting. And this was followed with I passed large clump of tissue. And when I say large, it's not as big as it was last time. I wasn't crampy at all. I didn't feel uncomfortable whatsoever. But it was, I don't know, like the size of a grape, if I had to explain it. So I thought, more is coming. I should go home, because you guys know what happened last time. I had to go into a Kmart bathroom, and I was like, I'm just going to go home. And unfortunately, I had to say something. And so I had to tell my sister, and I had to kind of stop everything really suddenly and leave. And I know my dad and my brother were like, what just happened in the bathroom? And it was really awful. And I came home and I cried, and I sat in bed with Mike, and the bleeding had stopped. I wasn't cramping at all. I was fine. So I think I was being a little prematurely upset, and I was just ready for it to be over, because once I kind of knew that things weren't looking good, I just wanted to be over, and I still sit here weeks later, and I'm still in the thick of it. And that's hard for me, because I just want to be able to flip a switch and be done. And I don't have the patience to go through the physical kind of aftermath of everything. It's almost like an extra punishment, like, oh, you're not pregnant and you're going to have a really terrible period for 5 weeks. Like, and I know I'm exaggerating a little, but I just wanted to be done. And I think I was trying to kind of rush it in my mind, like, oh, okay, every little hint that it was starting, this is it. So at the follow-up ultrasound, where they hadn't seen anything and that little bright spot they were looking at didn't change, the nurse was like, the owner of the practice is going to be here tomorrow. I'm going to send him pictures of your ultrasound, and I'll call you if he wants to see you. So I had to wait an extra day and still take all of my drugs and go in and see him the next day. And this is where I think things got a little out of hand, and I almost want to write them a letter, just so that he knows in the future what his interaction with me felt like. So we go in there because this is such an unknown. At no point did anyone say anything about what they thought was happening. And I was being really foolish, and thinking, oh, it can't be that bad, whatever it is. And he's just going to confirm it's a miscarriage. He's just going to confirm that we have to just watch my blood work. My numbers will come down, and it'll just like last time, it'll be fine. Mike and I went in, and we had to wait a really long time to see him. And he did a transvaginal ultrasound, just like the one I had had the day before. And everything looked pretty much the same, except in one day's time, that little black blob had turned into kind of a big milky looking blob. It went from being really, really small, like the size of a raisin, to being like this big and kind of cloudy. And he said very casually, like, oh, this right here could be endometriosis. And at no point has anyone ever told me that I have that, or probably have that, or should be checked for it. So to say that so nonchalantly in passing, like, oh, this little blob here could be endometriosis, that's kind of a harsh thing to hear in that situation, especially so casually. So then what he did was he had me get dressed, he came back in the room, and he was looking at my chart and the progression of my betas, and kind of trying to do some equation to figure out how far along I technically was. And at that point they were saying 8 weeks, but that seemed too far along to me from what I had tried to figure out but really couldn't, because I had no information to go on. So they were just going by my last menstrual period from August 10th. And he said, there was a nurse in the room. I think because whenever there's a male doctor, they have a female nurse in the room. and he just kind of glanced up at her and said, she needs methotrexate. Had it not been for videos that I've seen in the past that some of you have posted about having to take that, I wouldn't have even known what that was. And he wasn't saying it to me. He was just kind of, he's just a very intense person. So I can't fault him for that to an extent. But instead of looking at me as a patient and as a concerned person who just wants to have a baby and just wants to have a healthy pregnancy, even though I know something's wrong, I would have much rather heard, hey, I'm really sorry to tell you, but this is what's going on and this is what we have to do. Instead, he just kind of shouted that directive at the nurse, and she went off to try and like get that set up for me. So then he said that it looked like it was a corneal pregnancy, which is a form of ectopic pregnancy. And I don't know why, but that hadn't even occurred to me that it was an ectopic situation. But once he said methotrexate, I thought, oh goodness, this is going to be a long road. I just know it. And he said, you know, we'll go off to a side room here and we'll discuss this with you. Well, by now it was really close to the end of the day when the practice would be closing. And they kind of acted like, well, you're not having any pain. We don't have any in the office to give you. So you have to go pick some up at the pharmacy and you can bring it back here. And they posed it to me a little bit like, you could rush over there and come right back and do it now, or you could just wait till the morning. So Mike and I were like, well, is it urgent enough that we should do it now? Or, you know, does it matter? And they're like, no, you could wait till morning. Well, Mike dropped me off at home, and I went to lay down on the couch, and I sort of adjusted myself in my positioning, how I was sitting, and I felt a really sharp pain on my side. And after that, I got nervous because it was sort of a little bit crampy, and I think that was mostly from the probe in the ultrasound. But that shooting pain sort of, it snowballed into being a really intense cramping. When I say that, I say it was like, you know, a 5 on the pain scale at the worst, but it was this rolling pain feeling where it was kind of always there, but it would get a little bit worse here and there. And I thought, well, I don't want this to rupture because I know that that is a risk. So I thought, well, let me just calm myself down and get more information, because I think I'm just scaring myself right now. Because I wasn't told really what this is or what this means for me personally. So I did the thing you should never do, and I Googled it. And if you Google corneal pregnancy, there's some really scary stuff that comes up. And most of it has to do with the fatality of the mother in that situation. So I thought, well, this certainly didn't sound like something that was this serious. And now I'm scared because it hurts, and I don't want to play around with this. I don't want to wait till tomorrow morning to get my medication. So I called Mike and I said, I'm going to go to the emergency room. I just think that's what's best. And also kind of, I guess, in a way, get a second opinion at the same time. So normally Mike thinks that I'm just exaggerating and overreacting, but he dropped everything. He left work and he went with me. He took me to the emergency room, and it was packed. It was so full, and they took me within 10 minutes. So that told me, yikes, this is probably a lot more serious than, I mean, I know I can't judge what everybody else is there for, but it was a little scary. They gave me fluids right away. They were taking my vitals. They gave me a little tiny bit of morphine and something for nausea. And they got me a room pretty quickly. And it took several hours, but they did confirm that my diagnosis was right and that I would need the methotrexate. And they were basically saying, you know, if this were to rupture or open up in any way, you would have to have emergency surgery and you can lose part of your uterus. So this is really dangerous to, eat certain things or take certain supplements because you could make it worse. So they said I had to immediately stop the Lovenox I was on, no blood thinners, no over-the-counter painkillers, no folate, so no folic acid of any kind, no multivitamins. And they said, you just have to kind of pay attention to how much you bleed, and how much your pain increases over time, and, contact them. And they were giving me a lot of instruction. I was getting a lot more information in the emergency room, in the busy emergency room that I was in my posh little fertility center. So it was scary, but it was a little more comforting to have the information. Unfortunately, they couldn't just administer the methotrexate, and everyone who talked to me about it was like, they would tell me, this is a chemotherapy drug. And then they would pause for a really long time and kind of look at my face and study it. And finally I had to say, because they were sort of acting like, you have to, there's this whole jurisdiction thing between who works with the hospital and who doesn't. And my OBGYN is through the hospital I was at, but not the fertility center. So they're like, you kind of need to be seen by someone who can perform surgery with our center. And they were really trying to drive it home because I guess people must be difficult sometimes about that. And finally, it was getting to be midnight, and I had gotten there at 4 o'clock, and I just said, I don't want this to be worse than it is. I will do whatever you want me to. I have no problem with, coming back here and being seen by my OB. I don't have any ties to the fertility center where I would insist that they see me at this point. So please trust me. I know what you're saying. And I know that they just have to be thorough, and because if it turned into an emergency situation, I would need to be seen by someone who could actually perform surgery within the hospital. So, and if I had made it to 9 weeks, I would have been graduated into my OB's office anyway. So I was only a few days away from technically being seen by them in the first place. So it really wouldn't have been a problem. But the fact that I needed the methotrexate meant that I had to be sent up to the maternity ward, which is not a place you want to go when you're losing a pregnancy. It's not. But I had to go up there at 1 a.m. and wait and wait and wait for some nurses to come in and give me 2 shots, 1 on each hip. And then I had to wait and wait and wait to be brought back to emergency so that I could be sent home. And so just having to get the methotrexate in a different department added like 4 hours to the night. And Mike was pretty tired and pretty miserable. But we made it through. We came home. We got home at like 2:30 in the morning. And we just went straight to bed. And I felt pretty much fine the next few days. I had no bleeding. Well, I had the same spotting I've had all throughout. It really didn't increase. No cramping really at all. And no change for the most part. So naturally I wasn't too surprised when my blood work results showed that I hadn't made any progress. And they want to see a 30% drop in your HCG between day 4 and day 7 after having the shot. And my beta went down by 100 the first time and then up by 100 the second time. So I received a second HCG shot this past Monday, which was oh gosh, I don't know why I'm even trying to remember what the date was. This past Monday I had a second shot. And they do it by your height and weight, and at the hospital they just asked me what my height and weight was. They just took my word for it. Luckily I had just been weighed at the fertility center because they were trying to get me the methotrexate. They just didn't have any there. So I haven't been weighing myself, but they weighed me there. And when I went to my OB's office, They weighed me twice. They measured my height twice. They were very precise about everything. So I had 3 shots of methotrexate just because of the way they divide the dose, I guess, is different from the hospital. 2 on my left hip, 1 on my right hip. The left side is where my ectopic pregnancy is. And today I have to go and have my first round of blood work done as my first day 4 from the second shot. And then on Sunday, there's a lab that I have to go to that is open on Sundays. And I'll probably find out my results on Monday. And then hopefully there's enough of a progression that I don't have to have surgery. Because if I can avoid that, oh my goodness, I would be so grateful to be able to avoid that. But I'm a little scared that's not going to be the case. So I still haven't really started bleeding at all. But today I had unbelievable cramping. If I had to rate it on a scale of 1 to 10 for pain, I'd say it was like an 8. Mainly because, I don't know, I just expect that there has to be something that would hurt more than that. You know, I'm sure contractions would be more painful, but I was really, really out of it today. I was in so much pain. And I hate when I say that to any kind of healthcare provider because I forget that they are automatically going to think that you're fishing for painkillers, for some kind of drugs. And I wasn't at all. I just wanted to know, you know, can I take Tylenol now? Is it too early? Because they said that in the first 3 days, they didn't even want me taking that before. But today, my doctor was like, if you can get it over the counter, go ahead and take it. But anything more than that would mask, you know, a rupture, which they'd need to know about. So, oh, thank goodness. I took 2 little pills of Advil and I feel like a completely different person. I mean, I got out of the shower and it took me like 3 hours to get dressed after I got out of the shower because I was in so much pain. And at one point, all I felt like I could do was just sit on the toilet, and there was nothing coming out of me, out of either end. But I just felt like that was the only place that I could sit because it kind of felt like really, really bad bowel movement cramps, more so than any kind of uterine cramping. But apparently that's normal, and I hated to go in there today and make it sound like I was some kind of pill popper and just looking for some heavy drugs. You know, I just wanted the tiniest bit of relief. I was in a lot of pain. So thankfully I'm not really experiencing any cramping now, but that also means I'm not really having any progress. So I'm a little nervous about that, but all I can do is wait, and I hope I don't have to have surgery. I hope I don't have a rupture. I hope my life isn't in danger just because I got pregnant. Unfortunately, I am at a higher risk for having another ectopic pregnancy, and even more of a high risk if I do it through IVF. So that's frustrating and hard to hear. But every doctor that I've talked to, the one in the hospital, the one at the fertility center, the one that I talked to, he wasn't my doctor, but he was in for him because he was on vacation. But the one in my doctor's office, the day I got the second methotrexate shot, every one of them is like, don't give up. This doesn't hurt your chances in the future. Don't feel like you can't keep trying. It just feels silly to keep trying at this point because I don't want to be in this position again. And I just feel like, how is this ever going to be worth it? How will this... I don't know. I guess I'm just not there yet. And you do get there. You get to a place where you can lift yourself up and try again. So I will have to worry about that when I am in that position, which could be a really long time from now. I've read a lot of things that are conflicting about when you can try after you've had methotrexate, especially multiple doses. So it's going to be a rough, holiday season. It's going to be a rough few months. So long as I get through it alive and well, that's all I can ask for. But I'm feeling pretty down, and I'm just trying to take it one day at a time because it's really, really hard. And Mike has been so wonderful. I know I don't need to tell you guys that. He's just so perfect. But I just hate to think of putting him through all of this again and ever being in this position again. So that is it. That is what happened to me and what is going on. And I'm sure I will update you guys at some point when I have more information and when I'm feeling up to it. But right now, that is all I have for you. So thank you for the support. Thank you so much for just always being here to let me know that you care for us and wish us well. It really means a lot. But that's all I've got. And I will talk to you guys when I have a resolution. And hopefully it's a good one, and hopefully it's fast. Thank you.